Hello and welcome to News 9 Facebook Live with me, Adarsh Vepachedu. When it comes to COVID-19 mortality rate, India has fared better than most other European or Western countries. While you may attribute it to immunity, lifestyle or diet as the possible reasons for fewer deaths, that seems to be more than meets the eye. Did you know that proper ventilation in indoor spaces, especially in a country like ours, may have helped keep the number of infections and in turn deaths in check? I'm being joined by Dr. Shyam Agrawal, the first author of the study that has thrown light on how important good ventilation is. He's also the chairman of the oncology department at Sir Gangaram Hospital in New Delhi. Many thanks, sir, for joining us. Now, most of us have cribbed about not having air conditioners at home, but it is this very absence, it seems, of air conditioners that may have kept coronavirus away from many houses. So how did you carry out this study and what did you find? And can you say with certainty that ventilation and COVID mortality are related?
Look, Adarsh, the whole thing began virtually in December, January, when the people from Wuhan or China, traveled to all over the world. And, what happened from January to March was you saw a huge spurt of cases in Europe and the USA. And that was the time when the India didn't have that spurt of cases or large number of cases. The Indian, spurt started virtually in April onwards. So why is this difference there? That prompted us to look into the various reasons. And what we could figure out was from our analysis that, people, when you live in closed spaces,
right,
the virus is, staying in the on the fomite, on the surfaces of your, for example, your computer, your table, your laptop, your telephones. And, you are going into the same space day in and day out at your home, at your office, and you're mixing with people. And if you are living in closed spaces, the ventilation is not there. So then the air doesn't take away the virus from these, from the air and even from these fomites. So whereas when you compare this story with India, so when you are, living in an office or working in an office, you may be getting the contamination with the virus.
Correct.
But when you come home, most of the Indian homes do not have centrally air-conditioned or closed spaces.
Yes,
we, by and large, live in open, ventilated houses. And that, I think, is the primary reason why, India lagged behind in getting the number of cases going in our country. But now, as you know, the Indian, subcontinent, or India particularly, has a high number of cases which are rising.
Correct.
Why is that? In spite of open ventilation. I think the reason for that is that we are living in, one house, 4 people, one house, 7 people, or in jhuggies, jhompadis, and so on. So where the social distancing or physical distancing is not possible. So if one person gets infected, well, then you're affecting more and more. Whereas in US and Europe, well, now the people have started observing social distancing and using maybe masks more and more, and therefore the number of cases have come to a decline now. So, this is a theory to my mind, which people are working on, and I'm very convinced. In fact, we are embarking on a project in our hospital to do this study, but I think certain hospitals and certain areas in US have shown the presence of coronavirus in the air of the rooms where people are kept, for example, in the hospitals. So, this airborne infection, to my mind, is a contributing factor, which contributed initially for lower number of cases in our country.
Well, indeed. Groundbreaking study that you have put forth, Doctor. Another question that I have in mind is a little scientific, but you could tell us in layman terms as to what an air exchange is and how important is it? Now, again, does it all boil down to sensible construction, architecture and nuclear families? You were speaking about how there is quite a bit of population density. In one house, you have quite a few people crammed together. So doesn't it also boil down to ensuring that we have nuclear families and also, of course, ensuring proper fenestration with proper architecture in place?
Yes. So, let me, I'll give you one word. What some of the people in US say that they are living in sick buildings. Right. And why is that? I'm just going to tell you. So why they call their places as sick buildings? So when you're doing an air conditioning of an office or of a house, so there is a amount of or a number of minimum number of air exchanges which are required.
Correct.
So what do you mean by air exchange is that in order for you to get in fresh air from outside, you need to do a minimum number of air exchanges in the air handling unit of the air conditioning system. So something like 5 to 10 air exchanges per hour is what people have been doing so far, which I understand from the architect friends. But now if you look at the guidelines which are emerging for COVID-19 from American Air Conditioning Society, from REHVA, which is the European Air Conditioning Society, and even from the Indian Air Conditioning Society, so now they have come up with guidelines that those air exchanges should be increased from 5 to 10 to no less than 15. So the idea of having more air exchanges per hour is that you bring in more fresh air into the room so that the old recirculation air, gets more flow of the ventilation or the outside ventilation. So, this is becoming a very, very important factor, which will, remove the old air from the room and bring in fresh air from outside. But is it being implemented? I think that's $1 million question. Well, number one. Number two, so, today we are inflicted with COVID virus. Tomorrow there can be another virus or another germ, another bacteria, another, a fungus, which could be a killer for the human society. And this is what this COVID virus has done. We are all talking about vaccine. We are all talking about remdesivir and so many other medications. Nobody is talking about how to clean the air in which we live. So I think it's a very, very important issue, which I think people should take forward, whether it actually afflicts everybody, whether you're living in a house, you're living in an office, you're in a hospital or whatever. So I think the clean air which we breathe is extremely, extremely critical for our well-being, I would say even survival today, as we have been afflicted by COVID virus.
Now, Dr. Shyam, you were speaking about how coronavirus is very much in the air and nobody is really doing much about it. Well, we at News9 have constantly informed the viewers that yes, coronavirus is airborne. We've also constantly told our viewers about how the World Health Organization has come out and said that, look, coronavirus is there in the air. You must ensure that there is proper ventilation and it could also spread. Now, given the kind of inputs coming in from the World Health Organization, you also have a study on it that you yourself have authored. All of this is there. Shouldn't the government do something about it? As you rightly pointed out, there could be more dangerous viruses or bacteria that humankind could face. So do you see that there is a strong need for policy decisions, policy changes on ground, and especially when it comes to the construction management part of it? Do you think we should be looking at the future now instead of doing the things the way we have been all these years?
You see, a couple of things I like to say here. For example, during the summers, say for example in June, when the courts opened up, the High Court of India, or from Delhi, they said no air conditioning. So they are cognizant of the fact that air conditioning has to play a role. But then let me come to the science. So, there are a few studies which have been performed on COVID virus in the world. I'll quote one study from Oklahoma, Nebraska, where one physician called Dr. Santarpia, he studied the samples of air. He studied the samples from exhaust fans. He studied the samples from the table, from the bed of the room in whom the patients were staying. And they could demonstrate the presence of virus in all these, air, etc., etc. But there are some studies who are not corroborating. So, people want an irrefutable evidence that this virus is present in air for longer periods of time, which is responsible for its spread. Currently how it spreads is, so when I speak or shout or laugh or whatever I do, so the virus in droplets go from one person to another up to 6 feet or so. And that is why the role of physical distancing or a 6 feet distancing is there. But I think although the WHO has agreed from some Chinese studies and certain other areas where they have studied that the virus is present in the air. I'll give you one more example.
Please.
For example, there is a study quoted in the Journal of Infectious Diseases where from I think Wuhan itself, in the restaurant, when the people who were sitting in a stream of an air conditioning.
Correct. It was a restaurant, if I'm not mistaken. And in that stream of air conditioning, the air, a lot of people got infected.
Exactly. So that it got infected because the virus was floating in the air. So, but then, people are still, particularly from US, they're looking for much more evidence that this virus is airborne. And I think a lot of work needs to be done in that direction. As I said, we are embarking on a study here in the hospital, our hospital, and actually, given this theory, we have in Gangaram Hospital altered our air conditioning system. We have increased the air exchanges, as I told you, to 15 air exchanges per hour, so as to have more ventilation in the air conditioning system. So, people are working on it. But as you asked that whether it should be a government policy, it's a huge change which is required to be done, and you need to, back it up with the scientific studies so that it can be implemented on a larger scale, not even in our country, but even abroad.
Well, there you have it. That was Dr. Shyam joining us all the way from New Delhi, author of a study that has now been published, speaking about how important indoor ventilation really is. Many thanks, Dr. Shyam, for joining us. So there you have it. You and I must ensure that we are in clean atmosphere, ensure that there is proper ventilation. And yes, if you do not have an air conditioner at home, consider that as a boon. If you have it, ensure that it is turned off, ensure that your windows and doors are open so that there is proper air exchange, and all of this to ensure that the coronavirus that is airborne doesn't get to you. If you've liked the information that we've shared with you, do not forget to like, share and subscribe to News 9 on YouTube, Facebook, Instagram and Twitter. Many thanks for joining us.